Hi, everyone. Thank you for joining us today for our webinar. I want to give everyone a few minutes to join before we begin. For everyone that's just joining us, we're still giving people a few more minutes to join the webinar before we begin. Thank you very much for joining us. All right, so about 30 more seconds before we begin our webinar. Hi, everyone. My name is Nadine, and here at School-Based Health Alliance, we would like to thank everyone for attending today's webinar titled Health Resources and Services Administration Health Center Program, Fiscal Year 2019 School-Based Health Center Capital Program. During today's presentation, school-based healthcare experts will speak about this funding opportunity, share examples of how two programs are implementing telehealth services and what renovations and equipment might be necessary, and take some questions. But before we begin, we have a few housekeeping reminders. First, please help us with our attendance count. If you are viewing as a group, please go to the chat window in the chat icon and type in the name of the person registered and the total number of additional people in the room. For example, Tammy Jones +3. This will help us with our final attendance count. Also, all attendees are in listen-only mode. However, we want to hear your questions. To ask a question at any point during the webinar, please use the Q&A icon located in your Zoom toolbar. We will address questions following the presentation. At the end of this webinar, attendees will be asked to complete an evaluation poll question. Please let us know how we're doing. Your feedback is vital in helping us craft presentations that meet your needs. This webinar is being recorded and will be archived on our website in 3 to 5 business days. Please also visit School-Based Health Alliance for additional archived webinars for topics such as the ones you are viewing on your screen. The School-Based Health Alliance works to improve the health of children and youth by advancing and advocating for school-based healthcare. When health and education come together, great things happen. Attendance improves, conditions like asthma or diabetes are better managed, behavioral health issues get quick expert attention, and we all know that healthy students make better learners. Now I would like to introduce our presenters today. Laura Bray is the VP for Strategy and Knowledge Management at the School-Based Health Alliance. She oversees the Programs Division, Consulting Services, Staff Development, and provides training and technical assistance on school-based health program planning, implementation, improvement, and sustainability. Her career includes 25 years of school-based health experience at the local, state, and national levels, 5 years as a principal of a consulting corporation, and 10 years of hospital and federally qualified health center administration. Tammy Anderson is the Director of Programs at the School-Based Health Alliance. She directs the School Oral Health Initiative, State Leadership, State Affiliation Relations, and provides training and technical assistance on school health program development and implementation. Her career includes 25 years of school-based healthcare field experience at local, state, and national levels. Tammy Greenwell is Chief Operations Officer for Blue Ridge Health, a nonprofit federally qualified health center in Western North Carolina. Tammy provides operational management and compliance oversight for 12 practice site locations, including primary care, pediatrics, behavioral health, dentistry, and 5 SBHCs. She holds a Master of Public Health in Administration, a Bachelor's of Science in Nursing, a credential as a professional in healthcare quality, and certification as a certified medical practice executive. Thaddeus Labhart is the Clinical Director for Community Counseling Solutions in Oregon, which provides behavioral health, developmental disability, and primary care services throughout Oregon. Thaddeus has 20 years of experience in integrating and improving care, particularly in rural settings. Thank you, everyone. I will now turn it over to our presenters.
Hi, everyone. This is Laura Bray, and I'd like to welcome you to today's webinar. First, I want to walk you through what today's agenda will be. I, along with my colleague Tammy Alexander, will be going through a highlighted overview of the HRSA Notice of Funding Opportunity, also from now on referred to as a NOFO. We will be discussing, as I mentioned, highlights and point out the key specific parts of the NOFO that we feel you need to pay attention to. And by we, I mean those of us at the Alliance who've been working on this webinar. We want to make crystal clear that you need to read the NOFO in its entirety several times and familiarize yourself with the many required forms, deadlines, and other information that must be provided. This is very document heavy, along with other requirements of information that you must provide in your narrative. After we go through the NOFO, then Tammy Greenwell will be presenting about their services at Blue Ridge Health Center, Then Thaddeus Labor will be presenting on the community counseling solutions work. And then we've allowed for 15 minutes of question and answers. So as far as objectives, by the end of the webinar today, we want you to be able to assess your eligibility for and also hone in your interest in applying, what areas are you wanting to apply for under the 3 types of funding opportunities included in this NOFO. Also, we want you to be able to better understand and describe how 2 states are utilizing telehealth to provide the mental health, substance abuse, and nutrition related counseling services for obesity, so that you might think about how you might be able to do that and what type of changes you might need to make in your existing school-based health center to facilitate that. And we also want you to be able to know some of the examples of the type and cost of the equipment or renovation or alteration of space you need to do to undertake this work. Before we get started, we'd like to launch a poll for the 4 of us that are presenting today so we can better understand who's on the call and where you see yourself by answering a few questions about this. Really would help relate to eligibility. So Nadine, do you walk them through how to do this?
So they can see the questions right now. If everyone's viewing their screen, there are 3 questions that we ask. We ask that everyone vote and give your response. We have a really big viewer list today, so I want to give the people enough time to make sure everyone answers the questions. I'm going to give everyone about 15 more seconds and then we'll close the polls. Okay, thank you very much. I'm going to share the results. Laura, can you see the results?
I can. I'm just looking at the last one.
Okay, perfect.
Okay. All right. Let's move on to talk a little more about eligibility. So thank you. All right. So to be eligible for this money, these are the major requirements that you have to meet to even think about doing this. You must be a school-based health center that's already in existence, or the sponsoring agency of that existing school-based health center or centers, depending upon how you will apply. So if there's not already a center in place, meaning that's active, you would not be eligible. I am going to put in place here that if you have another way that you are providing services at the site and you're not within the building itself, let's say your center, your school-based health center is in a modular unit on the grounds of the center, you'd be eligible. If you even pulled up every day or, you know, half of every day at the center with a van, a mobile unit, you would be considered an existing school-based health center because you're already there. And there's other ways that we'll talk about throughout this, but you really need to have an actual official agreement with the school that states that relationship that you have, you know, an organizational agreement. We call them MOUs, LOAs, or if it's a lease agreement, it should be pretty clear. And you need to have those in place to show that you really are in a school-based health center at that school. Second, if you plan to apply for AR, which means alterations and renovations, and or equipment, you cannot have received capital funding from the previous HRSA, which is the Health Resources and Service Administration capital opportunities that came out in fiscal year 2011, 12, or 13 as part of the Affordable Care Act. So let's say you were a sponsoring organization and you have 7 school-based health centers and you got money in the last proposal from 2011, 12, or 13 for 4 of those 7 sites. The other 3 that you did not get money for could be eligible, or maybe they're brand new sites that, not brand new, but brand new since 2013, and they would be eligible for receiving the money. So it's not that the sponsor can't apply. It's just that you can't apply for funding for a school-based health center site that received the money under that capital opportunity in 2011, 12, or 13. Third, you must serve a large population of children eligible for medical assistance, also known as Medicaid. So that means that you already have that large population. So for example, what's an easy way to know that? From the poll, some people don't know. And so what is the free and reduced lunch rate of the schools where your school-based health center is located? If it's 70, 80, 90, 98, 100, then that's, the higher that number is, the more that you know you're serving a population that should be eligible for medical assistance unless they're undocumented and they can't get Medicaid, okay? So, and it means that you have a large population to serve. So if you only have 300 or 400 people or students at your site, that's not necessarily a large population. And if only 50% of them were eligible for Medicaid, then that might not be considered a large population. So you need to keep that in place. And Tammy's going to tell you a little more later about that particular requirement. You also need to demonstrate specifically that the alteration, renovation, and or the equipment money that you're going for is going to increase access at your site, which also means more numbers of delivery of services in these 3 particular areas: mental health, substance abuse counseling, and childhood obesity related services. It can't be used for the services. It must be that by buying this piece of equipment or by having this special room changed for this purpose, I now can provide better mental health, substance abuse counseling, or childhood obesity related services. If you weren't providing them before and now you're going to be able to do it, that might also be because now you've renovated and you have the space, but it can't be for the cost of the services or the personnel, only for the alterations, renovation, or equipment, okay? So let's talk about the types of funding that this application will support. First of all, they anticipate that there's going to be a lot of applicants. So they want only 1 application per sponsoring organization. But within that application, that sponsor can apply for up to 4 minor alteration renovation projects at 4 different school-based health centers. But it could be one equipment only project, and up to 3 minor AR projects together, one equipment only project, 4 AR. I mean, you could do any combination of those, but the maximum funding for everything cannot go above $100,000. Okay, and it's very specific how to go about writing it. If it's for equipment, you put one equipment. If it's for equipment only, you write one application for all 4 sites and you list all the equipment. But if it's going to be for 3 minor AR projects and some equipment, then you kind of have to split them up and show how each of those 3 sites is going to get their AR project and the equipment. So it's a little different depending upon what approach you're going to take. Okay, so let's talk about what is considered a minor AR project. If you've never worked in this area before, I could see it possibly being confusing. So first of all, think about it's something that's going to modernize or improve, reconfigure the interior of your site or physical characteristics where you're located. And it can also be to pay for the installation of permanent equipment that you're going to use for this project at a facility versus movable equipment, which is the next one. You can buy related movable equipment to locate at the proposed site that you're going to renovate, or it can be equipment that you're going to move back and forth. So think about a minor AR project cannot increase the square footage of a facility. So we call that, you can't break the footprint. It can't be a construction project, and it cannot be part of a larger construction project. It's strictly for renovations within the existing space. Next, movable equipment are non-expendable items with a useful life of more than 1 year that are not permanently affixed and can be easily moved. Items with a unit cost of $5,000 or more, or items with a unit cost of less than $5,000 with a useful life of more than 1 year are all considered movable equipment. When you go for the equipment, which I think a number of you may do, the equipment list is required for each project, and that a separate list is included unless you're only going for an equipment project. So what is an equipment only project? That would be the purchase of this movable equipment, as I just mentioned, with a useful life of more than 1 year. Or as I talked about earlier, one movable equipment project for any number of the operational school-based health center, or in addition to the 3 minor AR projects. I know it sounds confusing, but when you go back and read the NOFO, it will become clearer. So examples of other things you can use for equipment, a mobile van. So let's say that you don't have any more space in your school-based health center, but you felt if you bought a movable van that you could provide substance use counseling. I'm just giving an example. Or that you're going to use for mental health. That's one option. You can also, as we talked about earlier, we're going to have our presenters talk about telehealth equipment. Laptops and servers that would help you with that telehealth equipment. Possible of video conferencing equipment, scales, but you can't buy an EHR with it. That for sure, that question has already come up. Okay, so let's look at some of the required documents. I mentioned earlier, there's lots and lots of required forms. So the first thing to remember is that HRSA has moved into what they called a 2-tier application process. And so by doing this, you have to first go to grants.gov and complete the items listed here by April 17th. And then I've listed on here, page 6, it gives even more detail. So you have to go there first, fill out all those things, do that by April 17th, okay, which means a project abstract. The sites you're going to be doing this for or with, the lobbying form that's required but to be eligible for money, the key contacts at your organization, okay? And then the next group is, the next step is a whole group of required documents that's in the HRSA electronic handbook. Next slide, please. Nadine, thank you. The HRSA EHB Gov application components must be all completed. The final deadline of pushing that button is May 31st, Eastern Time, midnight. However, I definitely wouldn't wait that long. You have to do an uploaded project cover page, and that's where you're going to put in that whole narrative and all these other forms and assurances and things like that that you need to have in place. If you're doing an AR project, you have to have floor plans and schematics of your site, what it looks like now, how you plan to change it. But it doesn't have to be done by an architect. You have to do all your budgets and things like that. So this is the most detailed component, but once you do grants.gov, it lets you go into HRSA EHB and begin to look at all the other forms and things that need to be completed. And then additional documents are, can you go to the next slide, please? You have to also include documents like the equipment list I mentioned before, the funding sources, there's an environmental checklist, other requirements for sites. And again, these are all the listed page numbers for things. Landlord's letters of consent. So what you need to know, something that confused a lot of people in the past that were applying in the 2011, 12, and 13 was notice of federal interest. And so if you're in a school, for example, the school owns that property, but once the government comes in and pays for renovations and things like that, or the equipment, they are the caretakers of that space. And so the landlord has to consent and saying they're giving the consent for this use. And if it were a true, more capital thing, that they have, the government can have a say in what you do with that site after they've paid to have the renovations done. And they also have a say in if the equipment is still usable and that center closes down, where that equipment would go. And so the landlord has to write a letter of consent, and there's specific examples in there for you of how you would get that letter. And then you have to fill out things if it's in a historical site. Let's say the building's on the historical registry. Forms you have to fill out for that. So that's why I said there's many, many things. And then these are the specific attachments that are required and all the page numbers where they're referred to, which are your operational agreements, which is that MOU, LOA, or lease agreement. Collaboration, how you prove you do collaboration with other groups. Attachment 3 is the budget narrative. And then in the NOFO, it talks about attachment 4, and then it also talks about 5. I think it's a typo. It's attachment 4 that are other relevant documents, and those are all referred to on pages 7 and 19. Again, this is an overview, and for many are asking questions, and yes, the slides will be sent to you afterward, so you'll be able to go back through these lists. April 17th, again, this is the deadline where you go in, but don't wait until then. Go in and do your application packet, download it, and make sure you submit phase 1 by April 17th. And then again, here's the link to the HRSA EHB registration and submission date, which takes care of phase 2 or tier 2. And that has until May 31st. And keep in mind the funding period cannot exceed 2 years. The funding would start February 1, 2019. So it's almost a whole year from now. And it would end, all the funds must be used by January 31, 2021. And now I'm going to turn it over to my colleague, Tammy Alexander, who's going to tell you some more about qualifications and criteria for award.
Well, good afternoon, everyone. I'm really glad to see we have quite a few people on the webinar because that excites me that you guys are going to go after this money. So I want to continue some of the information that Laura has covered, but I want to call out a few specifics because they're sprinkled throughout the NOFO. And I just want to make sure that you guys are drilling down and really paying attention to some of these disqualifications or non-allowances. And you know, I think one of the key things is just incomplete, not on time, inaccurate applications, not paying attention to your limit, multiple applications. These are the things that Laura has mentioned, and especially increasing the physical footprint of your existing site. and not including anything that has to do with another major renovation. So these are called out in addition to the eligibility as disqualifications. And so we'll continue the disqualifications on the next page. And there is a, go ahead, Nadine. There is a wrinkle in the NOFO about sites who received money from previous funding in the fiscal years 11, 12, and 13. You can apply for equipment only. And so that's deep in the NOFO, but it does exist. So if you are not eligible to apply for additional renovations because you received money during those 3 fiscal years, you could apply for equipment only. Laura's covered the deadlines. Don't wait, get into those. We're going to give you those websites towards the end of my time. So go ahead and we'll just keep going, because these are, again, these are just reiterations of some of the pieces that Laura has talked about as eligibility, and how if you don't adhere, you're uneligible. It will not be allowed. You'll be booted out. Your application will just go goodbye. Just another way to look at it. You know, you can do up to 4 minor projects, or 1 equipment only, and 3 minor projects or equipment only. Any other version of that won't work. They will boot you out. Go ahead. All right. So we've covered some of this also. What's most important here is that people have been asking on the chats about operating costs, and Laura did touch on this about no direct funding for clinical services, rent, mortgage, refinancing, any of those pieces, or any major pre-construction prior to 90 days of the award date. So let's take a look at that for just a minute. Let's pause on that. So let's say you apply and your sponsoring agency and partners are willing to take a little bit of a gamble and start to lay out some of the architectural pieces, the engineering pieces. If they occur 90 days prior to the award date, you will not be able to get reimbursed for those if you are a successful grant, you're successfully compete for this grant. If your sponsoring agency and partners do want to gamble that you're going to be successful on this and want to go ahead and start with some of that planning and architectural and engineering pieces, if it's within that 90-day time frame of the award date, you are eligible to apply some of your money towards those costs. Next. So this just gives you a sample of how detailed the restrictions are, and Laura's touched on many of these, if not most of them. They have them summarized really well on pages 20 and 21 of the NOFO, and so it really helps to see them in one place. And this is just a continuation of making sure that you understand what the mobile vans can be used for. Can you install trailers? You know, can you do this? Can you do that? There's some very specific answers to saying you may not use this funding for these items. And I think it's really important to, you know, make sure that you're not trying to stretch into some of these areas, because they will find it in your budget, they will find it in your justification, your narrative, and you will become ineligible for funding. All right, moving on. So this is the important part. You want to write your grant specifically to the reviewers, and the reviewers are going to be given 5 criteria that they're going to look at. Each criteria will have a different point value, and you want to make sure that you are literally using their specific language, their specific emphasis, and so you can be, you know, you can be successful. So the first criteria is need, and it's very important just to describe your target population and what their needs are related to those 3 focus areas of mental health, substance abuse, and childhood obesity-related services. Sometimes in the NOFO, it's a little confusing. It says and/or, but if you get down to some of the very specific wording in disqualifications and eligibility, it is all 3. So make sure you're writing to mental health, substance abuse, and childhood obesity-related services, initiating or increasing access to these services. Review criteria number 2 is worth 20 points. And this, you know, you need to answer the question, what will this project enable you to do? So you want to talk about how the project will increase access to the 3 focus areas, describe the extent to which you're going to leverage other services to support the initiation or expansion of services in the 3 focus areas. And you really want to document your collaboration and coordination through letters of support. So the next criteria is impact, and it's worth 15 points. You want to be asking yourself, how will quality of care and patient outcomes be enhanced, and how are you going to tell that story? And they very specifically called out the second bullet about how will the completed project increase access to the services for the 3 focus areas, and it calls out the number of unduplicated patients served annually at the SBHC who have increased access to these services. And number 4 is resources and capabilities, worth 25 points. And there are at least 3 links back to the NOFO and forms for this criteria. And maybe I should stop for a minute and tell you about the links. So when you go to the NOFO and you get down to the criteria and how the reviewers are going to be looking at your application, each section will have a link, a hot link, back to the beginning of the NOFO where they write with more specificity about this category. And the example here is resources and capabilities, but each of the 5 criteria have a link back to more specificity than what they're writing about in the part where you have the review criteria. So you want to take time to get that hot link and go back up and make sure that you pull out the succinct and salient pieces that they're asking you to write to and connect the review criteria and what they're saying in whatever other place in the NOFO they take you to. And this one, some of them only have like 1 link. This criteria has like at least three very important links. So take your time to go back and forth in the NOFO and read and match up what it has to say. So resources and capabilities. So they want to know, what do you currently provide and what's your foundational approach to how you provide your services? And the second bullet is really concerned about staffing and the resources for sustainability as you begin or increase the services in the 3 focus areas. And the bullet 3 really specifically deals with not only documenting your capacity to implement and complete the proposed project, it specifically calls out the leased sites. And I think Laura touched on about leased sites and getting consent from your landlord to do this project, especially with the federal funding that she discussed. And for the sake of time, I'm going to encourage you to read the bullets when you get the copy of the slides, and of course go to pages 21 through 23, and see the specific requirements that they have laid out. And the 5th review criteria is worth 10 points, and last but not least, it's the support you're going to be requesting. You really need to make sure there's clarity in your budget documents and the forms, and that they relate specifically back to the project description and justification. So sometimes there's, when putting grants together, you might have another person helping you with the budget, another person might be writing the narrative and the work plan and those kind of pieces. Get them together, make sure they all align and that they meet the requirements that they're asking you to do. And there are a lot of forms in this section, so be sure that they're all connected and they're saying the same thing. All right, so we've covered the 5 criteria that the reviewer is going to be looking at. And just in case you haven't ever applied for a federal grant, this is merit-based ranking, so they're going to have independent reviewers. And they have their set criteria with 30 points and 25 points, et cetera, et cetera. So they are going to be just marking it down. Are you meeting our criteria? Did you fill out the forms completely? Did you do all the, cross your T's and dot your I's? And they may take a look at geographical distribution, but they don't determine that ahead of time. They will see when they get all the application and see what's going on. The second thing that will happen, independent of the reviewers that are going to be taking a look and grading you on those 5 criteria, is that there is preference given to school-based health centers that serve a large population. And Laura mentioned that I might be talking a little bit more about this. A large population of children eligible for medical assistance under the Medicaid plan, Title 19, or a waiver in Title 21. So they don't give a definition for large, but Laura gave you some examples and parameters. If you want to have consideration for this funding preference, you must request it and meet the criteria that is laid out in the grant application. You'll find it under the proposal cover page form in the HRSA EHB on page 24. If you do not request it, you will not be put into a different category. The independent reviewers don't know whether you are seeking this or not. They're not grading you on that. The HRSA staff will determine that funding factor. So if you want technical assistance, here's some of the links. We are sending the slides out to you. You don't have to try to write these up really quick. They're very full of great information since we're giving you the high-level balcony view of everything. And if you go to I like the second one the best, the frequently asked questions PDF. It really spells things out in a very simple way with, I don't know, about 12 pages of frequently asked questions. So that's a really insightful part that you should go to. And then there's one more page with a few more technical assistance links, and I'll wrap it up. Okay, so this is an interesting process, grant process. This is a two-tier application phase. And so that's why you see 2 dates, 2 websites, and it's sort of different than past grants. Maybe some of you have done the 2-tier application before, but you might want to go to the HRSA site that talks specifically about how to do this 2-tier application. And then if you're really sort of new to applying for grants, the second website is really a good generic how to write a good grant resource. And so with that, I think I'm going to turn it over to Tammy Greenwell because we've done our high-level balcony thing. But before I turn it over to Tammy, I just want to do a shout-out to Tammy and Thad for coming on, taking time out of their days to prepare for this and to be here because they have boots on the ground. And it's really important to hear their perspective about how they've been doing some of this work. So with that, Tammy, I'm going to turn it over to you.
Thank you, Tammy. I'm going to talk a little bit about our experiences at Blue Ridge Health with telehealth counseling and nutrition services. Just to give you a background, Blue Ridge Health is a not-for-profit, privately owned FQHC in Western North Carolina. We serve a 7-county region. We have about 35,000 active patients, 132,000 annual patient encounters. That includes primary care medical, dental, behavioral health. We also do substance use disorder treatment, including medication-assisted treatment. We have 340B pharmacy services and nutrition services. We also provide mobile dental services, and we're a teaching health center medical residency program, and we're also a migrant health center. We do have 5 school-based health center sites. 3 of those are in elementary schools. We have 1 in a middle school and 1 in a high school. We do receive some state funding, actually for 2 of those sites. Our state in North Carolina is focused on adolescent health. So we receive funding at the middle school and high school level. We do have billing at all locations. We do provide services on a sliding scale for those that are uninsured or have a high deductible, but we do bill all insurances. And our school-based health center sites, there's a lot of different models, but we follow a comprehensive model. We provide medical, behavioral health, and nutrition services. Our clinical staffing is mainly a mid-level provider, a nurse, certified medical assistant, and then behavioral health counselors, licensed counselors, or those with substance abuse, treatment, addiction specialty. And then we also have dietitians. We have telehealth sites. We have those at the other school locations that don't have a school-based health center. So in the county that we serve, there are 16 additional schools that do not have school-based health center sites. And actually, there's one more school. There's actually 17. There's the alternative school as well. And what we have provided via telehealth has been behavioral health and nutrition counseling. We did get funding from the original grant back in 2011. We got the grant for only equipment only, and it was really to purchase the telehealth units so that we could provide behavioral health counseling. And at the time, we were only thinking about behavioral health counseling. Some of the issues we faced, one of the first things was connectivity. That became a main issue during startup, and how we would be able to connect the hub and spoken sites, because it became exceedingly expensive to do that. So we were trying to figure out, how do we do this in a cost-effective way so that we can cover the cost through billing. The other thing is that equipment and technology is constantly evolving. At the time, we used a Polycom system, which was very expensive to implement, hardware dependent, and I think we used probably 95% of our grant funding for that equipment to get it set up. So there wasn't a lot left over for the connectivity issues. And then there were staffing changes at the schools where we originally had to place the equipment. So we were constantly having to re-educate administration each school year if those people changed, and kind of what the system was and how it was supposed to work. So it was a lot of work as far as getting everybody on board and keeping them informed. So we began providing behavioral health telecounseling, and the way that worked, we would receive referrals from the school. The counselor would go out and do a face-to-face for the first meeting, and then make sure that the student was, a good candidate for telecounseling. And once we established that, then the remaining sessions would occur via telecounseling. And we also added nutrition counseling services so that we could also reach students who had BMIs that were overweight or obese. And we tried utilizing the system for that as well. Our ongoing funding was supported via patient revenue and grant funding. And when I say patient revenue, the billings for it, the state of North Carolina does not recognize dietitians as people who can bill under Medicaid for those services. So we basically were providing those for free to the students, as well as the telehealth counseling, because they also don't recognize behavioral health counselors. So we were really only able to bill private insurances, and then any of our students that were being seen on a sliding scale, we could bill them as well. So we had to get a lot of grant funding to help to support the program. And then, as I mentioned before, the internal staff turnover at the schools, and then as well as our own staff turnover when we would lose a counselor who was familiar with the service and able to provide it. Then we were trying to get someone else trained to do it. And we really had to sell the service a lot to our own staff as well as the schools. Some people didn't think it would work very well. So a lot of people had doubts. And so we really had to spend a lot of time selling the service. I think it's a little bit easier now. I think a lot more people have embraced telehealth, but 7 years ago, that wasn't the story that we found. We do provide telehealth now through a HIPAA compliant app called VC Messenger. We use actually the school's Wi-Fi network now when we need to connect. We use an iPad, so we don't need a specific room for equipment. We need a private room. The initial outlay, we purchased VC Enterprise, which is $2,000 a year, but you can have up to 11 providers connected at one time. And then the cost of an iPad. So much more cost effective than the Polycom system we started out with and all of the hardware dependency we had. As I mentioned, we had to change some of the telecounseling provided only if the payer source would provide for our counselors or our dietitians to provide that service. So if we have a student who needs those services and they don't have a payer source that will pay through it via telehealth, then we actually make arrangements to go out to the school to see the student or bring them to our location. And then, training not only our staff, but the school staff so that they were compliant or that they were comfortable and that they understood that the system was compliant with HIPAA and we weren't violating any of that by using an iPad, you know, that really we needed the private room for the conference to occur. We are looking at expanding telehealth to other counties to help support our school-based health center program development. And we're going to be adding primary medical care, and we're looking at doing some group visits and other things to help support that. So we'll be applying for the funding that's on the table as well.
Excellent. Thanks, Tammy. Hey, Thad Labhart here. I know we're running short on time, so I will be pretty quick with these slides. We just have 4 left for me, and then we'll field some questions. Just a little context real quick. I work for Community Counseling Solutions as the clinical director. We're in rural Oregon, and we provide the spectrum of services. You can see our budget and our employees there. We have a number of outpatient offices and residential. We operate within 3 school-based health centers. We own one of them, and then we have 12 different private contracts with schools throughout the core counties that we operate in, where we provide a number of different services. And just some quick disclosures here. I'm more of a Jack or Jill of all trades, if you will. I am not an IT professional. I'm not a HIPAA or a FERPA compliance officer. I'm not selling or affiliated with any hardware or software, although I'm going to talk specifically about what we use. I'm not a billing expert, and I think everybody needs to do diligence in looking at the efficacy of telehealth. There's starting to get to be a lot more literature out there about that. All these things need to be considered when you're looking at equipment. Nadine, can you go to the next slide? So here's what we use. In rural Oregon, we have limited providers at times. So about 12 years ago, actually, we started with basic Polycom units that our Medicaid provider, our CCO or MHO, if you will, a Medicaid carrier, purchased on our behalf for all offices in their scope of influence. And those type of units, and it's not just Polycom. There's all sorts of companies that offer these type of hardware units out there. On the low end, you're looking at $150 refurbished, up to $10,000 for a camera. I would say a basic starter package is going to be somewhere around $500. We purchase a lot of these annually. We've since moved to what's called a video system. This was secondary again to our Medicaid carrier, applying for, ironically, a United States Department of Agricultural grant, where it was a 2-to-1 match, where our coordinated carrier, our Medicaid organization, put in about a third of that $661,000. And this allowed for a capital outlay with equipment, TVs, connectivity, and the staff to introduce that across a lot of different offices. And they paid for our ongoing access and use of the software so associated. So a lot of you are probably going, well, that's great. We don't have that. But third paragraph there, no need to fret. You can really get set up, just like Tammy was saying in the previous set of slides here, at very low cost, whether that's with HIPAA compliant software, whether that's with basic desktop cameras and a basic software package. They can be very inexpensive to get into, depending on your needs. And another thing to consider too, there's a lot of existing telehealth companies that already offer and have services and have the staff. You would just need the equipment, and they can patch right in, and there's seasoned veterans in it. Here's what I'd consider if I were you. You definitely need to understand HIPAA and FERPA and how this plays into it. You need to become tight with your compliance officer, your department there. They're going to help you navigate that. It's very overcomable, but that's definitely something to consider, as is IT. You need to have somebody who knows what they're doing to network in, especially if you're working in, let's say, a school where you're going to be running on their network, so you don't have the full controls. You're going to need to have somebody that can bridge that relationship and the actual networking capacity. You need to educate your patients. sometimes people, they're coming in to see a psychiatrist and they're shocked to see it's somebody on video, not a live person. You need to educate them up front about that, and you certainly need to document consent to be seen via video. That'll help you get around a lot of HIPAA and FERPA issues. I snicker here because I think initially on the slide said billing documentation challenges, but I wrote opportunities instead. These are easily overcomable as well. A lot of times it just requires a simple modifier on the billing code that you're going to use. This is something you definitely need to consult your payers for around feedback. In the Medicaid world, it's very doable, particularly on the behavioral health side for mental health and addiction. This is the biggest thing I'll say in these slides here is let the need drive the decision making. A lot of times we go out and pursue these grants because, oh, it's an opportunity to get some great equipment. But what is your need? What is missing? What gap do you need to fill? And that should drive your whole thought and application, in my opinion, around this process. We mainly use it for prescribers, psychiatrists who don't want to live out in rural Oregon. We have one that lives in Portland. We have one that lives in the state of New York. We use some out of Texas. Specialized counselors, we oftentimes provide telecounseling, even just with our own staff. Maybe we have a licensed counselor in one of our offices that's 3 hours away. We just patch them in to see the patient right there in our office or in the school-based health center. And one thing I wanted to say here, it's more than just provider time too. You can use this equipment if you have it to provide supervision, meetings, educational opportunities for your staff, meetings with community partners. And that's not per se the focus of the grant. It needs to be about patients, but that's an upside, a byproduct that can happen. And one last slide for me here. I think it's okay to think big if you want. If you want to start out with a starter kit, that's great. We're moving in our strategic plan to where our patients potentially won't even have to leave their home. Of course, this involves having written consent and how to get that from home, but also, allowing them and helping them set up an app at home or on their phone where they can see one of our providers at the school-based health center or an outpatient office right from their chair. That's obviously a much bigger mountain to climb, but I think it's okay to think big. And if any of you have direct questions, which we're going to get to here in a few minutes, you're welcome to email me at that email there. Thank you.
Thank you very much, Thaddeus, and all of our presenters today. So we are running a little short on time. We have a lot of questions in our Q&A box, but I still want to give people some opportunity to do that. While you guys are writing in your questions in our Q&A box, I just want to get to a few announcements. So let me tell you a little bit about our membership. The School-Based Health Alliance works to improve the health status of children and youth by advancing and advocating for school-based health care. Our members extend and support our work. Trainings like this webinar would not be possible without the support of our members. In addition, our members receive exclusive access to valuable program tools, timely publications, and networking opportunities. So please take a moment after the presentation to join our website using the link on your screen for more information to join. In addition to that, our 2018 convention will take place on June 24th through the 27th in Indianapolis, Indiana. So please save the date, and we look forward to seeing you there. All right, so now we're going to ask our presenters a few questions. I will start with our Q&A box. So someone asked that question. So I have someone that asked, what about health centers that operate as a portable site satellite location, which will be built out as a school health center co-located in a school, not identified as a school health center under our current scope of service yet?
So Laura, are you muted?
Nope.
Oh, there
Go
you go.
ahead, Tammy. You can react
I would answer that.
after that. Yeah.
Yeah, you're not an existing school-based health center, not identified as a existing school-based health center. You would be unable to apply.
I agree. So if you are not considered a school-based health center and you don't have an MOU that says that's what you are, and you can't apply. You're not eligible. So the other thing, before we go on with any more questions, I want you to know that any of these questions, you can also, if you need further clarification, you can direct them to that Q&A piece with the FAQs for the actual HRSA grant itself. And if they're not listed there, I mean, we tried to check them, but if the particular question you're asking is not located there, you can ask it of the project officer and they will give you a response. The second thing is any of the questions that came out here, and we don't get to answer them, we will, live, we will respond to you. Okay. Go ahead.
So I'd like to add in, Laura, that's really great, on the FAQs, on the very last page of the FAQs, and that was listed website for the technical assistance, it tells you if you're having this difficulty, if you have this specific question, go to this person, go to that person. So hopefully, you know, some of this, I've already answered some of the questions in the chat box that's just too specific. We didn't see it represented in the NOFO. So it's best to call HRSA directly and ask the question.
So if our mobile unit is very old and requires so much repair, can we apply for a replacement?
Well, is your mobile unit being used currently as a school-based health center, and is there any kind of existing paperwork that describes the relationship and the services that you provide as primary care? And would you be able to initiate or expand services or access to services in those three focus areas? So if you meet that basic framework that says, do you operate as an existing school-based health center, et cetera, then, and you can show that you know that this would increase access, then I would think that you could do that. But that might be a specific enough question just to pick up the phone or to shoot them an email.
Yes, I think you would have to demonstrate how it will not sustain what you already have because it's in such bad shape, but how purchasing a new one or renovating a space in the school in lieu of that unit would increase your services in those three areas. I hope that helps.
So the other thing that we've been noticing is that we've got Q&A, we've got questions in the Q&A, and I've tried to answer some of them, and we've got questions in the chat box. So as Laura said, we're gonna, if we don't get to these because we're almost at the top of the hour, we will directly get back to you. If you answered a question, asked a question anonymously, we probably can't get back to you. So let us know, and we'll be happy to follow up with you.
Yeah, so we still have a lot of questions to go through, but unfortunately our time is almost up, and I would like to run one more poll question because we definitely want to hear your feedback about this excuse me, about this webinar. So I'm going to launch that poll. All the questions that we were unable to get to at the moment, we will make sure to respond to these questions and give you access to these questions or answers at a later date.
I do know while you're doing that poll, let's multitask. Tammy Alexander, there were several questions in the chat box and in the Q&A about can you, let's say I applied only for equipment in the last application, can I apply now for A&R? And I really don't know the answer to that one. It's clear about the equipment, but I don't know about A&R if you applied for equipment. Tammy?
It doesn't appear that it doesn't appear that it's excluded. So I think we're going to call in too and ask that question.
Yeah, I think we'd have to call in and get back to you guys with that because that one I had not. You guys thought of one I hadn't thought of. So yeah,
we will find out the answer.
And just so you know, Tammy and I can stay on and continue to answer questions if you want to stay on. But if you have to leave and we can't answer your question, then you know what, we can stay on for what, maybe another 15 minutes if we need to at the most.
Sure. To everyone, that if we're unable to get to your question and you asked it anonymously, feel free to ask the question and send it to our info@sbhaforall.org email address, and we'll definitely make sure that we answer your question. So we do want to thank everyone for attending the webinar today. And I want to thank our presenters for sharing their wealth of knowledge about this. As Laura said, we will try to still answer some more questions for a few more minutes. But thank you for everyone that was able to join us today. So Laura, I can start from the beginning or the next question. So how do you have an example of how you might be asked to use that site once HRSA provides funding for it?
So I'm not clear. I guess what I'm saying is that if you got money, I think you have to, Tammy, isn't there a commitment that you have to commit to a certain number of years, or I have it confused with the previous 2011?
I think I didn't see that requirement.
In the past, you had to stay in operation for 3 years, but let's say you accept the money, you renovate, and then within the school, you close your center. The notice of federal interest or the federal's interest in that, they can come back and ask before you close and all that, how are you using this equipment? Or with the school, what will that space be reallocated for? And they have a say, since they paid for the renovation. They have a say in where that equipment goes. So, I mean, repurposing it, maybe it's going back to the school nurse. I mean, I'm not sure, but that's how I would answer the question. They just want to know.
They just want to make sure that you're aware it's federal money, and they might have some pull in usability of that facility, especially if you close or something happens.
And they may want to actually take that equipment if it's still fairly new and usable, and give it to another site that they fund through HRSA. Reallocate it. Can you do another one?
If a Sbhc received HRSA funding in 2011 for equipment only, no renovations, is it possible to apply this round for renovations or funding for a mobile van?
We're going to ask that question.
That's the
not
question.
spelled out.
And then we can send it back out to everybody on the webinar, just because we're not sure who exactly would want to know, but we don't know the answer to that one.
Okay, a mobile van costs greater than $100,000. How does one tackle this ask?
You'd have to show who else is going to help you pay for the other part of it if it costs more than $100,000. Or buy a used van. I've seen people buy used ones. Tammy, you have anything else to add to that one?
Nope, that'd be my answer.
Okay. Services rendered are for children only. We see patients of all ages at our school-based clinics.
Well, when you write your response, you have to show how this is a school-based health center and not just a federally qualified health center. And I assume it's a federally qualified health center that's at a school. And you have to speak to what that population looks like and how you're going to use these services or the equipment you get to increase access for students, for children, not for adults. If you can't do that, then there's a problem. Probably you'd be. And I think
Sad said it best. Don't chase the money just to chase the money. Look at your need and let the need drive what you're applying for. And so look at what your kids are coming into your clinic for, and be able to describe how this project funding would facilitate initiation or increasing access around the 3 focus areas.
Great. So is it possible to add the square footage of an actual service area by adding a hallway to the clinical space? It would not add square footage outside the building.
Are you going to have to break any wall, break down any walls or foundations? I think that's doable. If you find an additional space and all you have to do is knock down a wall, I think that's probably okay. But not breaking the footprint, which would mean construction.
This is just minor renovations.
Okay. Let's see. Do you think that a mobile van purchase can serve children for additional reasons beyond childhood obesity?
Or mental health substance. If you have a van and you're using it for those purposes, I wouldn't tell them you're going to use it for anything else. but you have to demonstrate. I mean, if you have it available, and yes, you probably can, but you better be making sure that you're really showing how you're going to use it for those 3 things primarily.
In addition to primary care.
Right.
Okay. Is it permissible to purchase telehealth equipment for placement in school-based health center and a behavioral health clinic to facilitate behavioral health consults via telehealth?
Oh, you mean to pay for the other locations' equipment? That's how I interpret that. I don't think so. It did not address that at all in the, they would already have to be equipped for telehealth, don't you think, Tammy?
Yeah, that's, where is that, Nadine? What was that, in the chat box or the Q&A?
That's in the Q&A. That's towards the bottom.
I mean, because basically then you're equipping the other provider to provide their service. I would say no. I think it's only for the center.
But, you know, we could look into that because it says the telehealth equipment can be mobile. So we would need to look into that.
Yeah, let's look into that and get back for a better response.
Okay. For the presenters with telehealth in the elementary and middle schools, are parents involved in the 3 areas, or are children seen by themselves?
I don't think they're on anymore.
Okay.
So we would have to get back to that. But in most school-based health settings, students are seen with parental consent first, but then they're seen without the parent present. But that's not saying they wouldn't allow the parent to come and be there if that was the case. So it could be either way. They don't have to be present.
Okay. So we have a mental health agency who provides service at a rural school-based health center and have an MOU with them. Since the HBSC was originally set up by our local FHQC, does the grant need to be submitted by them?
Whoever is the sponsoring agency for that school-based health center, not for a mental health program. So I would say yes, the FQHC, if they're the ones providing the primary care, they're the ones that would have to submit the application.
You always have to go back to who is sponsoring the school-based health centers and who is the, the sponsoring agency that oversees primary care, all the certification and all the things that go along with that. So it can't be an outside agency applying for this. It has to be directly related to the school-based health center.
Is there a requirement in all states to have a licensed provider with your patients for telehealth, for any telehealth visit? If this is the case, how will you be able to provide counseling from a parent's home? Also, who are the providers needed for telebehavior health?
Oh, that's a big question.
That's a very good question. I'm going to start with the end of that question. Who are the providers? It's a qualified, what's considered a qualified provider in your state? Tammy Greenwell started to address some of that in the state, actually, of North Carolina. I used to live there, and I know that licensed professional counselors, LPCs, are definitely qualified to provide mental health counseling. However, it's a different story when you think about Medicaid and who Medicaid authorizes reimbursement or who credentials for mental health or substance abuse services. So it doesn't mean that they're not qualified, but who can you get reimbursed for in your state? So what Tammy Greenwell's predicament that she talked about was that they had qualified providers doing the work, but Medicaid wouldn't pay for them. They would only pay for a licensed social worker, master's prepared credentialed social worker or psychologist, different groups. So it really depends on what your state considers. If you're looking at qualifications or you're looking at reimbursement. So that's the answer to the second part of the question. The first part about providing it in their home, I'm confused about that question. Could you read it again, please?
Yes.
That first part?
So is there a requirement in all states to have a licensed provider with your patients for any telehealth visit? If this is the case, how will you be able to provide counseling from a patient's home?
Okay, so it's not required that there's a licensed counselor with the patient presenting. If you think about telehealth, there's there's the spoke and the hub. Okay, so the spoke in this instance would be the school-based health center. And who's going to present the patient, or if it's at home, who's the patient going to be in touch with? And then the hub is where the provider who's licensed. So it's a matter of that provider has to be licensed and credentialed who's providing that contact. They don't have to, whoever's presenting the patient could be, you know, a nurse, a secretary at the school, or things like that. But you have to deal with confidentiality and other rules around that. But it does not have to be that case. But if it's a joint presentation for med management or something like that, you would want to have a licensed professional there with them, but that wouldn't be taking place in a home. That would be taking place at the clinic. So, Tammy, you want to?
And each state, I think you're right on it. But each state has so many different rules and regulations about providers and the type of services they're doing. I don't think we could have a blanket statement about all states. And every state has a different Medicaid contract and different everything is so unique. When you know, like the old expression of when you've seen one school-based health center, you've seen one school-based health center. The same applies for, you just can't answer all providers in all states. It's impossible.
That's the key, that Medicaid is state-based. Medicare is federal at the national, but it's all based on what the state's rules are. And that's why this is a program not about funding and reimbursement and those rules. This is about providing the equipment or the renovations.
Okay, so using your best guess, is HRSA really wanting to use these funds to support telehealth versus small renovation projects?
No, I think it's whatever you need to do to increase the services. What I think this is leftover money from the 2011, 12, 13 appropriation that had to be returned because some schools weren't able to use it appropriately or use it all. And so they're trying to do their due diligence to let centers do what they need to increase the services, but in the three particular areas that the current administration is supportive of. That's what I think is happening. And I don't think they're saying telehealth over another. I just know telehealth is one way. You have to still have space that might need to be renovated for it. I just thought telehealth was what many sites might be going for as a way to increase services. And if that were the case, you know, we wanted some presenters to talk about how they've done it.
Okay. So would it be possible to use telehealth to provide nutrition counseling to a student in this SBHC while connecting to the parent at home? Or do people typically use telehealth to connect a student in a school-based health center to a remote nutrition consultation?
So this home question is coming up a lot, well, at least a couple times. So it's typically done, a student presents themselves to the school-based health center, and they don't have the specific provider on location, and so they use telehealth to access a more specific provider. And so as Thad was talking about, you know, he's got psychiatrists and other counselors in New York and in Portland, and because they don't want to come and live in rural Oregon. And so it's mostly done because you want to take care of the whole kid. You want to be able to document it. You want to be able to be the connector to the telehealth provider, the special counselor, the nutrition counselor, that specific licensed or certified person. You want to be that connector and that support for that child who's accessing your school-based health center.
And I don't think this is necessarily targeted at all at hooking up parents from their homes into this, because that would require other kinds of HIPAA compliant equipment in that. I think it would be more if the parent wants to be present, they would have to come to the school where they're being hosted at the school-based health center. And then, yes, they're usually being connected to a nutritionist at another location or a dietitian.
So I like the question, if I heard correctly, the funding request has to show how we are increasing or implementing services in all three areas. Yes.
Yes, not just one.
Okay. All right. Would exercise equipment be allowed?
Yes, it's spelled out right in the NOFO as an option. But I also think you have to say how they're going to access it and use it. It can't just be, oh, we're going to buy all this exercise equipment. Where's it going to be located? Do you have to renovate the space to do, all that kind of stuff?
What's the need? Get back to the need. Get back to how these funds are going to be used to meet that need.
And to increase services.
Access to services.
Well, access means, well, how are they going to measure it? By increased utilization.
Yep. Okay, so
can we apply for funds to renovate a school health clinic into a SBHC? We have an MOU and currently use a mobile unit to provide services.
Tammy, you take that one because we talked about it earlier.
That's a very specific question. And if you're using the school-based health, the mobile unit to provide typical school-based health center, primary care, et cetera, and you're going to a school on a regular basis, although they don't define whether you have to be part-time or full-time, but you have an MOU with that school to be providing and to be acting as a school-based health center, then we think that it's very doable to take this existing school health clinic, or is it a nurse's clinic or something like that, and move your mobile unit into that. Again, that's not, those very specific questions are not spelled out in the NOFO, and I would encourage you to call and ask HRSA directly that specific of question. But our read of the NOFO, that makes sense.
There are questions in the chat box. We received a HRSA capital grant in, I think I answered this one, 2011 to construct 2 school-based health centers and purchase telehealth equipment. Are we eligible to apply for an equipment-only grant to expand telehealth to increase access for the 3 focus areas?
Yes.
Okay. Let's see.
Tammy, even though they applied for equipment in the first round, are they still?
Oh yeah, that's one of our questions we have to answer. I'm sorry, there's 2 parts to that. Renovations, if you renovated with that, yes, Laura, thank you. If you renovated with any of those past funds, you are eligible for equipment only. But we're going to ask the question, if you applied for equipment in those past funding cycles, can you apply for other stuff? So we've got that down as a question to ask.
Because this particular question said they applied for renovations and equipment.
Yeah, we have to ask that.
Okay. There were 2 questions that we got prior to the webinar. We are a mental health provider within a school-based health center at a rural high school. Are we eligible to apply for funding as well as the school-based health center?
No, you're not, because you're not the sponsor. It has to be the medical sponsor. Who's sponsoring that? Primary care, the medical sponsor of the school-based health center. So in this instance, no.
Okay. And I'll have this be the last question. We would like to renovate space at a current high school health center into a school-based health center. I'm sorry, health clinic into a school-based health center. Can we use these funds for this renovation? Currently, we use a mobile unit to provide clinical services to this high school. The school district supports this renovation.
So that's sort of like the last question, a couple questions ago, about if we have a mobile van and we're acting as a school-based health center, can we renovate this, this nurse's clinic or whatever inside the school to be an SBHC? And if, do you meet the parameters of an existing school-based health center? Do you provide, primary care? Do you have an MOU? Do you meet all those things that says you're an SBHC? Then our reading of the NOFO says that that's possible. All
right. So we do have a few more questions, but we will send these over to our panelists, and we'll make sure that they will answer them and respond back to you. So thank you very much for everyone who stayed online to listen in on these answers for the questions. And like we said, the webinar will be available online on our website within 3 to 5 business days. Thank you guys very much.
Thanks, everyone.
Thanks, everyone. Good luck.